Hear this interesting story of Dr. Ignaz Semmelweis. Austrian government released this coin. This is Dr. Ignaz. He was born 200 years ago. He was working in Vienna maternity hospital. There were two wards. In one ward, doctors did deliveries. In second ward, nurses did deliveries, midwives did deliveries. In first ward, every third or fourth mother and baby died of fever. They called it childbed fever. In nurses ward, very few women died. Those who delivered on the road, they also did not die. Ignaz wondered why. Then his room partner friend, doctor friend, died of the same illness. Then he realized that the illness was not due to delivery. His friend had an injury by a scalpel, and that scalpel was used for cutting dead bodies of patients who had died to study their body, why they died. So Ignaz concluded that that blade carried something from the dead body to his friend and he died. And all doctors did cut open dead bodies of patients to study them, and then they went to see the mothers in the delivery ward. So Ignaz concluded that the hands of the doctors carried that something which caused them fever. He had observed that if something was decaying and was foul smelling, and if chlorine water was put, the decay would go, the foul smell would go. So he started washing their hands with chlorine water before touching the women. He also started washing every instrument used for delivery by chlorine water. And with this, the deaths disappeared. This was revolutionary. But habits die hard and people don't accept new things. I'll show you the graph. The deaths increased after doctors started cutting patients who had died to see what killed them. And the blue line is of deaths in the maternity ward of the midwives, and the red is of the deaths in maternity ward of the doctors. After introducing chlorine water hand wash, the deaths totally declined. Then they stopped washing hands and again the deaths reappeared. And now we know that the germs, streptococci, they actually spread by hand. So hand washing helped, and now there is a coin in his name. They did not listen to him, they threw him out, he became mad, he was put in mental hospital, guards beat him, he had injury to his hand, and then he developed pus and fever and he died of childbed fever. Even today, after somebody dies and we go to crematorium, we come and have a bath so that we don't carry illness home. Similarly, all doctors and nurses wash hands before and after touching a patient. We all should do this, and we all must ensure that everybody washes hands before and after touching a patient. This alone will reduce illnesses in our society and it will save us, because many germs are not killed by medicines and prevention is better than cure. So share this video with all and save everybody from catching illnesses. Jai Hind. I am Dr. Hemant Joshi, children's doctor at Virar.